Welcome to another episode of Med Madness, where we delve into crucial medical topics that are essential for your USMLE preparation. Today we will explore the intricate and often misunderstood topic of Do Not Resuscitate, DNR Orders, and their implications in the context of administering intravenous thrombolysis for acute ischemic stroke. Understanding the nuances of DNR orders is vital for medical students and healthcare professionals. Misinterpretations can lead to ethical dilemmas and impact patient care. This podcast will help you grasp the essentials, ensuring you are well prepared for both your exams and real-life clinical scenarios. In this episode, we will cover the definition and scope of DNR orders, the appropriateness of thrombolysis in patients with DNR orders, the distinction between competency and capacity in medical decision-making, the application of DNR orders during hospitalization, a brief real-life case study to illustrate these concepts. Let's start by understanding what a DNR order entails. A Do Not Resuscitate order specifically prohibits cardiopulmonary resuscitation, CPR measures such as chest compressions and defibrillation in the event of cardiopulmonary arrest. However, it is crucial to note that a DNR order does not mean do not treat. It does not prohibit other therapeutic interventions that may be necessary to address concurrent or newly presenting conditions. When a patient presents with an acute ischemic stroke, intravenous thrombolysis is often a standard treatment to prevent further brain damage. The presence of a DNR order should not preclude the administration of thrombolysis, as it is not related to cardiopulmonary arrest. Patients with a DNR order should continue to receive treatment according to the current standards of care for their presenting condition. Next, let's discuss the concepts of competency and capacity. Competency is a legal determination made by a judge about a patient's overall decision-making ability. In contrast, capacity is a clinical determination made by a physician regarding a patient's ability to make a specific medical decision at a specific time. When obtaining informed consent, capacity is the key consideration. In our scenario, a patient with an acute ischemic stroke and a DNR order might have incoherent speech and an inability to follow commands, rendering them unable to make an informed medical decision. In such cases, the patient's substitute decision-maker, typically a family member, like a spouse, should be involved in the decision-making process. They should be provided with all relevant medical information to consent to treatments like thrombolysis. It's also important to understand that if the patient develops cardiopulmonary arrest following thrombolysis or during hospitalization, the DNR order should be honored. The DNR order remains relevant only for cardiopulmonary arrest and does not prevent other necessary therapeutic interventions that can significantly impact the patient's quality of life. Let's consider a real-life case study to illustrate these points. Mr. Smith, a 68-year-old man, arrives at the emergency department with symptoms of an acute ischemic stroke. He has a DNR order in place. His speech is incoherent and he cannot follow commands, indicating a lack of capacity to make medical decisions at this moment. The medical team evaluates him and determines that intravenous thrombolysis is the best course of action to mitigate the effects of the stroke. They inform Mrs. Smith, his wife, who is his substitute decision-maker, about the situation and the recommended treatment. Mrs. Smith consents to the thrombolysis, understanding its importance in improving her husband's condition. During his hospital stay, Mr. Smith unfortunately experiences cardiopulmonary arrest. The medical team honours his DNR order and refrains from initiating CPR, respecting his previously stated wishes. This case highlights the importance of understanding the scope of DNR orders and the necessity of involving substitute decision-makers when patients lack decision-making capacity. In summary, a Do Not Resuscitate order specifically applies to cardiopulmonary arrest and should not be interpreted as a directive to withhold other necessary treatments like thrombolysis for acute ischemic stroke. Understanding the distinction between competency and capacity is crucial in obtaining informed consent and ensuring ethical medical practice. We encourage you to engage with our pre- and post-podcast quizzes and use the Anki flashcards we have prepared. These tools will reinforce your learning and help you retain this important information. Thank you for joining us on this episode of Med Madness. Stay tuned for more insightful discussions, and remember, a well-informed physician is a better physician. Keep learning and keep growing. Until next time, take care.